My talk today is a little bit different than what you usually hear, which is I'm going to tell you a story. I'm going to tell you a story of brilliance and hubris. All great stories are like that. The brilliance of a young physician who saved literally thousands of newborn mothers from an untimely death, and the hubris of those who ignored his work. A hubris that resulted in the death of a president of the United States. And in this all, there is a warning, a cautionary tale for those of us on this board of directors and the staff of this hospital. The president was James A. Garfield, who 4 months after his inauguration was assassinated, was shot in the back by this man, Charles Guiteau. He was shot in the back. It was a relatively minor wound. Didn't hit any vital structures, missed his spine, stayed out of his abdomen. It's a wound that, had he been admitted here to Good Samaritan, he would have been out in 3 days and back to work. Unfortunately, the leading physicians of the day were called to his bedside. Physicians who had willfully ignored discoveries coming out of Europe about how to prevent infection. Those discoveries started here 34 years earlier in the 1850s at the Vienna General Hospital. At that time, women generally delivered at home, attended by a nurse or midwife. Those who couldn't afford the service of a nurse or midwife, the poor women, delivered at the Vienna General Hospital. And they delivered in one of two clinics. They could either deliver in the physician's clinic, which is run by physicians for the training of medical students, or they could deliver in the midwife's clinic, which is run by midwives for the training of midwives. Now, it really mattered where you delivered. These are the mortality rates by year in these two clinics. I call your attention to the purple line, which is the physician's clinic. In some years, the mortality rate for newborn mothers was as high as 15.5%. 15.5% of newborns died before they got out of the hospital. Now, the midwife's clinic did much better. Even in bad years, it was 7%. In good years, it was down around 2%. The disease that these women died of was called childbed fever or puerperal sepsis. The clinics alternated admissions. So on one day, all the poor women were admitted to the physician's clinic. The next day, they were all admitted to the midwife's clinic. So there was no reason they should be this different. Now, in 1846, this man, Ignaz Semmelweis, was appointed assistant to the professor of obstetrics. Now that meant he ran the poor people's clinic while the professor went off and attended to his fancy paying patients in the private homes of Vienna. And Dr. Semmelweis agonized over this difference in mortality rate. And he set about trying to figure out what caused the difference. Because with alternating admissions, there really shouldn't have been a difference. He considered overcrowding as a cause, but the midwife's clinic was more crowded than the physician clinic. A common theory of disease at the time was miasmas in the air. And so he thought about miasmas in the air, and so he improved the ventilation in the physician's clinic, but there was no improvement in mortality rate. He even imported the religious rituals from the midwife's clinic into the physician's clinic to see if that made a difference. But no difference. Then one day he had I wouldn't say it's a lucky breakthrough, but in 1847 he had a breakthrough. A good friend of his was doing an autopsy on a woman who had died of childbed fever and accidentally nicked himself with a scalpel. 3 days later, he died. And it fell to Semmelweis to do the autopsy on his friend. During that autopsy, Semmelweis discovered a disease that looked very much like childbed fever in his male friend who had died from this nick. And he reasoned that there must have been something on that scalpel that transferred the disease from the dead mother to his friend. He wasn't sure what it was, but he called it cadaverous particles. And he thought, our medical students are going back and forth between the autopsy room and the delivery room. Maybe they're carrying these cadaverous particles back and forth and infecting these newborn mothers during the delivery. So he instituted a regime of hand washing. Everyone going from the autopsy room to the clinic had to wash their hands in a chlorine solution. We now know that these cadaverous particles were strep bacteria. Of course, they didn't know that. Here's what happened to the mortality rate when Semmelweis introduced hand washing in the physician's clinic. In April of 1847, the mortality rate was over 18%. A month later, it was 2%. In 1 month. In fact, the next year, the mortality rate dropped 90% compared to the previous year. By hand washing, he saved an average of about 500 women a year in this clinic alone from an untimely death. Now, he didn't know why it worked. It took others, Louis Pasteur, who figured out that bacteria cause spoilage of food and drink, and then particularly Joseph Lister, an English surgeon, who read about Pasteur's work and reasoned that those bacteria may be causing infections after surgery. And so he introduced disinfecting of instruments and disinfecting of surgical wounds to surgical practice in England. And it made a huge difference in mortality rates. And that practice of disinfection rapidly spread through England and then into the rest of the continent in the 1850s and 60s. But it did not spread to the United States. This masterpiece by Thomas Eakins shows the famed surgeon Samuel Gross in Philadelphia in his operatory. He's doing an amputation, but I want you to notice he's operating in his street clothes. The bed is soiled with bodily fluids. His hands are bloody and the instruments are bloody from the prior operation. This is now 8 years after Lister's publications and roughly 28 years after Semmelweis introduced hand washing. There's no evidence that surgeons in the United States understood the importance of cleanliness. Now, it wasn't because they were unaware of the practice. In fact, Joseph Lister had come to the United States in 1876 for the centennial and given a lecture about hand washing and disinfection and talked about how to avoid infections after surgery. And Samuel Gross stood up in rebuttal after the lecture, and here's what he said. He basically completely dismissed the process, kind of arrogantly dismissed it. Another person there at Lister's centennial celebration was this man, Dr. Frank Hamilton from Bellevue. He was a very famous surgeon and particularly famous for writing a practical treatise of military surgery based on his Civil War experience. Read today, this is basically a virtual how-to guide to how to kill your patients by causing infections. Nowhere in its 674 pages is anyone ever encouraged to wash their hands. So Hamilton got up after Lister spoke and said, a large portion of American surgeons seem not to have adopted Lister's practice, whether from lack of confidence or other reasons I cannot say. Now, forgive the accent, but you get the point. He just arrogantly dismissed it. And unfortunately, that arrogant dismissal was to cost Garfield his life. After Garfield was shot, the leading American surgeons of the day were called to his bedside. Hamilton was one of them. And these surgeons probed his wound with their unwashed hands and dirty instruments, and they caused an infection that gradually spread through his back. Garfield lingered for about 2.5 months. He lost 100 pounds and finally died. And when he died, an autopsy showed that a fair part of what was left was pus. The death of Garfield really helped catalyze a revolution in American surgery because it was a bit scandalous. This is a painting from 14 years later after the Gross Clinic by Thomas Eakins entitled The Agnew Clinic. This shows David Hayes Agnew in his operatory in Philadelphia. Notice the change. The clean white smocks, the clean instruments, the clean hands, the sterile draping of the patient, the clean bed sheets. Finally, now, this is 40 years after Semmelweis's discovery and nearly a decade after Lister's presentation at the centennial celebration, we can see this. Unfortunately, too late to save President Garfield from an untimely death. Now, Charles Guiteau went on trial, obviously, and he rightly argued that it was medical malpractice that killed Garfield, not him. He said, I did not kill the president. The doctors did that. I merely shot him. The jury was unmoved, and Guiteau hung anyway. Back to Semmelweis. This remarkable man had done what was effectively the first randomized controlled trial in medicine, what's now the gold standard for medical discoveries. His discoveries have saved an estimated 100 million lives worldwide by preventing infections. That's quite a legacy. Was he made professor of obstetrics in Vienna? No. Was he made professor of obstetrics anywhere? No. His ideas were too hard for people to swallow. They didn't know what a cadaverous particle was. And also, particularly, his professor in Vienna was offended by the idea that his dirty hands were killing his patients. So he fired Semmelweis. Semmelweis went back to his native Budapest, where he practiced for a number of years, but he became increasingly irascible and angry. He was eventually committed to a mental institution and died 2 weeks after admission from a beating by the guards. The beating caused sepsis, the very disease which he had done so much to prevent, which killed him. Now,
the glory of being a right reformer.
Yeah, there is little glory in being right, is there? Yeah. Fortunately for the poor women of Europe, he had trained a generation of disciples who gradually spread his ideas throughout the continent. Semmelweis was eventually recognized. Vienna, the city that rejected him, or Austria, has issued a stamp in his honor. There's statues of him all around Europe. There's even a university named for him in his native Budapest. To me, the best monument to Semmelweis are these hand-washing stations that are ubiquitous in hospitals across the country now. I can think of no better monument to him. Now, I tell you this story because I think it matters, because what we do as a board and administration affects the future of our patients and the future of our hospitals. If we reject new technologies, we risk having happened what happened to Garfield. If we adopt bad technologies early, like those advanced endoscopes from Japan that caused all the infections, we hurt our patients another way. So it's a very difficult job we've got. I also wanted to pat you on the back to compliment you, because I think this board and this hospital administration, led by Charlie and Andy, has done a really good job at selecting new technologies. Think of cardiac electrophysiology, lithotripsy, advanced approaches to hip surgery, to name a few. We've done much better than our peers. Now, Charlie likes to say that you have to play the hand you're dealt. And we've been dealt a lousy hand, but I think we bet that hand very well. And if I can extend the poker analogy just a little bit further, we're in the final round with a very small pile of chips, but at least we made the finals. So thank you. Oh, that's a really good question. I don't think anybody's ever shown that they spread disease, but it sure is.
They touch them all the time.
Yeah. Well, no, worse than that, as you lean over a patient, they fall onto and touch the patient. So you wash your hands, but you don't wash your tie. Right. Or maybe we should insist on polyester ties.
Talking about in today's healthcare article I read today about banning lab coats because they're never washed. You know, you walk around with the same lab coat.
I can put on the latex gloves, but they do everything with the same hair. What difference does it make?
Yeah. Well, they're supposed to change the gloves with each patient. But the lab coats is, the lab coats is a problem because, again, the sleeves are touching the bedside. So, yeah.
Well, we shamefully treated Semmelweis. We honored Lister because his name is on Listerine, right?
Yes. It turns out he never licensed his name. It was an era where intellectual property rights didn't matter. So that company just named it Listerine without his permission, without paying a royalty. So he got nothing for that. Great. Well, thank you.
Great. Thank you.